Welcome everyone to the Social Service Workforce webinar series brought to you by the Global Social Service Workforce Alliance through funding to the United States President's Emergency Plan for AIDS Relief, PEPFAR, and the United States Agency for International Development. This For Children project is implemented by a consortium of organizations led by the Catholic Relief Services. Today's session is the 26th webinar in our series and is focused on supporting the social service workforce on the front lines of the Southeast Europe refugee crisis. We are pleased to present this webinar to you in a close collaboration with Terre des Hommes and the Child Protection Hub for Southeast Europe. I would like to remind you that this webinar is being recorded and you can find it on the Alliance website in the future. I'm Natia Patshaladze, Senior Technical Advisor at the Global Social Service Workforce Alliance, and it's a great pleasure for me to be able to moderate this webinar and lead the discussion with our very interesting speakers on this very important topic nowadays. As you can see on the slide, thank you, Nicole, I will provide a very brief summary of the social service workforce with refugees, about the role of the social service workforce with refugees and migrants. I will very briefly talk about the Global Social Service Workforce Alliance, and after that, I will ask our two speakers to continue with their topics of discussion. Our first speaker is Stephanie Delane, who will summarize the work of Terre des Hommes in responding to the refugee and migrant crisis in 2016 in Southeast Europe. And she will also talk about the work of TDH in general in this field. Stephanie is a social worker and has a master's degree in international child welfare. Originally from the United Kingdom, for the last 15 years, Stephanie has worked in Southeast Europe, in Asia, the Middle East, and North Africa. Her particular interest is working with frontline staff, and she has worked for a number of agencies. And during the Southeast Europe refugee and migrant crisis, Stephanie has supported a workforce capacity strengthening initiative carried out by TDH Lausanne in collaboration with the UNICEF Regional Office for Europe and Central Asia. And that was when I had a great opportunity to work with Stephanie. Our next speaker is Alexander Mitanovsky. He will share his personal experience of responding to the needs of the refugees and migrants in former Yugoslav Republic of Macedonia. Alexander is a social worker from Macedonia, and over 7 years he has worked on developing, planning, and implementing various projects at the national and international levels, focusing on children and young people, refugees and migrants, and many other vulnerable groups. Since 2015, Alexander has worked as a social worker of the International Open Gate La Strada in the refugee camp in Tabanovce, and he has been managing mobile team and directing service provision to the refugees and migrants there. After these presentations, we will make sure to have enough time for your questions and comments, and we encourage you to type them in the chat window, and we will come back to your questions after these two presentations. We would also very much like to discuss the topics of related to the capacity required for the social service workforce to address the needs of the refugees and migrants, and we'll try to briefly talk about the sustainability issues of the refugee response and the role of the non-governmental sector in supporting the workforce. So this is our agenda for today, and overall we have 1 hour to cover these very interesting topics. And now I'll continue with my next slide. We'll tell you briefly about the refugee and migrant crisis. And as you know, the world's attention has been focused on the tragedy unfolding for millions of Syrians, as well as children and adults from other countries, as they are forced to leave their homes and risk their lives in the effort to cross borders to find safety for themselves and their children. The total number of individuals who are currently displaced worldwide and live as refugees, asylum seekers, and internally displaced persons is at around 60 million individuals. Among them are close to 1 million migrants and refugees fleeing war in Syria and violence and poverty in other parts of the world who are displaced throughout Western Europe. These numbers have been steadily increasing over the past years as a result of persecution, war, and human rights violations in many countries in the world. Evidence suggests that the length of time a person spends displaced averages 17 years worldwide. And as a result, displacement has immediate as well as long-lasting social, emotional, and economic impact on the displaced individuals as well as the communities they are originating from and the places that they are displaced to. Next slide, please. On this slide, we're talking about the role of the social service workforce with refugees and migrants. And it is evident that at times like this, the social service workforce sector plays an important role in helping individuals and families to rebuild their lives. Their role is also very important in receiving countries and communities. And hence they play a very important role for the refugee and local communities. Social workers and other social service workforce have a fundamental role in defining the underlying causes of migration, as well as defining its consequences. In well-developed and well-functioning systems, social workers and other social service workforce focuses not only on service provision, but also on program design and policy issues related to refugees and migrants. And very importantly, social workers also focus on identifying and addressing the needs of the most vulnerable, being these unaccompanied children, young people, older individuals, persons with mental and physical health issues, trafficked persons, and many others. Social service workforce representatives play a key role in providing psychosocial support, a strengths-based perspective that builds on resilience, as well as utilizing general social work skills and knowledge for protecting human rights of the displaced children and individuals. However, at the same time, we have to admit that many recent events demonstrate that challenges the social service workforce is facing in general are preventing them from meeting all the immediate needs of the refugees and migrants and child protection needs of these individuals. The recent events also showed that when underdeveloped, understaffed, and under-resourced for meeting the needs of the local population, additional demands from the refugee and migrant individuals have a detrimental impact on the national child protection and social services systems and of the receiving countries, which is very important to consider. Next slide, please. Because of this reason, it is very important to be thinking about strengthening of the social service workforce in a regular context. And for that reason, the framework for strengthening the social service workforce that the Global Social Service Workforce Alliance is applying in its work is very relevant for addressing the needs and the gaps of the social service workforce working with the refugees and migrants. And on this slide, you can see the framework that I'm talking about. As you can see, there are three key areas reflected in this framework, which are planning the workforce, developing the workforce, and supporting the workforce. And even though we don't have much time to go into details of this framework, I would like to mention that implementing the activities listed on this slide really help with strengthening the social service workforce, which then provide adequate services for the local population, as well as increasing demand from the refugees and migrants moving to the receiving countries. Next slide, please. You can find the framework that I was just now talking about on the website of the Global Social Service Workforce. On this slide, we just want to briefly mention about the history and the role of the Global Social Service Workforce Alliance. As many of you probably know, the Alliance was established in 2013 with the main purpose to support capacity strengthening of the social service workforce. We're a network of about 1,900 people from over 120 countries in the world, and we're focusing on promoting the knowledge and evidence, resources and tools, and political will and action needed to address the key social service workforce challenges, especially in the low and middle income countries. And again, we're not going to go into details, but on this slide, you can see the strategies the Global Social Service Workforce Alliance is employing for achieving its main mission. And these are to convene and connect the main stakeholders in the field throughout many countries in the world, to advance the knowledge necessary for strengthening the social service workforce, and to advocate for strengthening of the workforce in many countries of the world. On the next slide, you will see one of the recent examples how we're trying to advocate for strengthening of the social service workforce. This is the call to action on strengthening the social service workforce to better protect children and achieve SDGs. And this call is very relevant at this stage and for the topic of our today's discussion, because it calls for the joint efforts of the nation at the national and global levels to improve protection, health, and well-being of children, young people, and families. And for doing that, we provide certain recommendations to the country-level actors and global-level actors that you can see listed on the slide. Again, we will not talk into in more details about the call to action. However, if you would like to show support, you can contact the Alliance and join us in this call to action, and you can find more details about the call to action on the Global Social Service Workforce Alliance website, which will be displayed on the slide at the end of our presentation. Next slide, please. Another very relevant thing to our topic of discussion today are the materials that the Global Social Service Workforce Alliance is producing and which can be found on the Alliance website. Some of them are produced by the Alliance, while others are collected in our resource database, and they are very, very useful for the social service workforce aiming to support refugees and migrants as well. One of the very recent resources that I would like to mention to you now is the Case Management Compendium, which was launched a few months ago and which contains pre-selected materials on several areas related to the case management. These are core concepts and principles of case management, tools and forms, SOPs, and training materials. All of these resources are very, very relevant for the social service workforce working with refugees and migrants as well. And again, this case management compendium can be found on the Global Social Service Workforce Alliance website. Next slide, please. So with the next slide, I would like to give the floor to Stephanie, who, as I've mentioned earlier, is the child protection consultant from TDH, and today she will talk. She will present to us the summary of the work of TDH in the region as well as globally. Stephanie, the floor is yours.
Thank you, Natia, and hello to everyone. So what I want to do today is two things, and apologies because this will be quite a quick gander through these issues, but obviously the recording will be available and so will the PowerPoints. So the two things I want to do is firstly to give a brief overview of the work of TDH Lausanne, and this is TDH is a federation, and I'm speaking specifically about TDH Lausanne in humanitarian context, and also their approach to capacity building, and secondly to introduce to the Southeast Europe capacity building initiative. Unfortunately, I won't have time to talk about all of the work that TDH Lausanne did in relation to supporting the refugees and migrants in Southeast Europe, but so I'm going to concentrate on the capacity building, partly because that's the topic of this webinar. So we can have the next slide, and I'll just quickly talk through. So as you can see from the slide, TDH works in both development and humanitarian contexts. And this ranges from direct assistance right the way through to being involved in global and interagency forums, and being involved in some important processes for articulating and establishing methodologies for working and also standards. So, for example, at the moment, TDH is actively supporting the development of, well, the revision rather, of the child protection minimum standards, and also involved with the rollout of the CPIMS information database for case management. Next slide, please. So TDH has a particular focus on capacity development, and it conceptualizes capacity development as an ongoing journey throughout the career of workers. So not being so interested in one-off trainings, but more thinking about training as being part of a broader range of approaches and methodologies, including not only face-to-face training, but also remote learning, mentoring, coaching, pre-service training and in-service training, and also thinking about using tools and materials to reinforce capacity. And it's important, I think, also to say that the focus is on knowledge and skills based on need. And by that, I mean that, as we know, there are many things which are extremely interesting to know, but not necessarily particularly relevant for the work or the role that we have to do. So a big focus is about what is it that people need to know, but also secondly, around how are they actually going to use that information? So what difference is it going to make in their practice with children and families? And furthermore, TDH recognises that they are part of a system, in terms of that it's not TDH's role or function or necessarily within their capacity to be all of the providers of training or of resources, but that where TDH is engaged in capacity development activities, this ought to be done with reference to what else is happening, other key actors which are involved in similar efforts, such as universities and institutions, so that efforts to reinforce capacity can be synergised with other efforts in order to maximise resources and to avoid workers being bombarded with information which is not helpful, particularly if it has opposing or diverging approaches. Next slide, please. So we're looking at the Southeast Europe Initiative, as Natia said in her introduction. It was a multi-country capacity building initiative which was funded by UNICEF Regional Office in Geneva and was as a response to the refugee and migrant crisis. It was implemented by Child Hub, which is an online learning and sharing platform which has been developed by a number of agencies and is based in Hungary, and actually looks specifically at issues for South and East Europe. And I would here recommend anyone who doesn't know anything about the Child Hub to please go online and have a look. There's lots of different resources and possibilities for learning, and particularly if you're from the region, that's the focus of where most of the regional initiatives can be found, and materials which are already contextualized and relevant. So in addition to the face-to-face training, which I will come on and talk about in a minute, the Child Hub and TEDASOM complemented this through different webinars and practice sharing. And I've just, for example, given a link to one particular webinar which was conducted with workers in Southeast Europe and also workers in the MENA region, being able to share their different experiences of working with this mobile population. And the work itself was carried out in 2 phases. And I have to say here, we had a very short lead-in and a very tight time frame. And as Natia mentioned, she was involved from the beginning. And in fact, I'm sure she can attest to the tightness. We were quite surprised that we managed to do everything in the time that we had. Next slide, please. So what were we doing and why were we trying to do it? Well, it's important to say that given the context where everything was extremely fluid and things were changing on a daily basis, what the objective was to try to plug gaps in the knowledge and particularly give practical guidance given the very challenging circumstances. So what hasn't been provided is an enormously comprehensive and detailed suite of capacity development materials. What we actually did was look and see what is it that people need to know right now in order to be able to do what they need to do now, and how can that be used, how can we make that slightly flexible so that also as the situation changes it could be adapted. So we were looking at meeting the immediate capacity building needs regarding child protection, thinking about increasing the confidence and awareness of people working with refugees and migrant families, and linked to that trying to reduce burnout and stress. We also hope that through this training, which was multi-agency training, we'd also begin to clarify roles and mandates and create opportunities for networking. And in fact, when we conducted the evaluation of the training, one of the things that people enjoyed most was having the opportunity to work with people from different agencies and also contribute towards identifying further development needs and also helping to articulate some plans for capacity building within this wider framework and within a longer term. And if we go on to the next slide. We had as I mentioned, there was a very quick turnaround. So how we decided to approach this was to develop a core set of materials based on need and then to contextualize those as we went. So the first scoping mission was to Macedonia, and we developed a core set of materials which within 1 week we had developed and piloted in country. We then, in the other countries which were involved, which were Serbia, Slovenia and Croatia, and also right at the end Italy, we then undertook very short scoping missions at the beginning of each of before the training in order to tweak and contextualize the core materials and to slightly provide a more training tailored package. And also depending upon the needs and the interests of the countries, we then followed up with some specific support packages. So some countries wanted training and trainers. Macedonia asked us particularly to come back and look at some issues around the way in which child-friendly spaces were being used. So we kept it very open. We trained 500 people in a very short time frame, just a few months. And in addition to those people trained, we also invited some observers from other countries who weren't involved in the initiative itself, in order to see if the materials could be useful in their own country. And that was from Bulgaria, Bosnia and Albania. And partly this was because at the time the routes that the migrants were taken were very fluid, and there was a lot of change with borders, and so we were never sure, and nobody was ever sure, which route the refugees might be funneled through at a certain point. So we wanted to include other countries who didn't necessarily have a problem, as it were, at that time, but could perhaps foresee one soon emerging. As we will see on the next slide when it comes through, we had identified a number of needs. First of all, it was what we needed to do was to support workers to be able to work, and that sounds very obvious, but you know we had to actually understand what the context was that people were working in. First of all, and here I think it is very important to say that Southeast Europe does have a cadre of professional workers in the social welfare workforce who are actually often are very highly skilled. But what they were facing was an uncertain system. So new partners, procedures that didn't necessarily fit anymore, and also having to use perhaps a very different approach, so having to use outreach and be more proactive rather than perhaps waiting for people to request support or being given referrals. And in additionally, we're having to work with different client groups where there may be cultural differences around, I put here especially around parenting. That was one of the big ones that people talked about, but also with different needs. So people on the move and refugees having a very different set of needs than people who are from within the country, who are experiencing some sort of hardship and as a result need support from social welfare. It was not just the social welfare workers which were included in the training, but also allied sectors and actors such as health, and various different agencies. And this was something that we identified very on in the first scoping mission, which was that actually the social welfare workforce was absolutely overwhelmed with need, and that we recognised that actually by helping to give some of these other actors key training in child protection, we would actually be able to help manage or give some better shape to the work that the social workers were being asked to do. Also, two other things which were important to take on board, which was first, we needed to appreciate that a lot of training was already being given but to people, and that people were overloaded, both with demands on their times, but also with the demands of working in an environment where there were a huge number of people with great need. And I don't know how many attendees, sorry, are on the webinar who actually were present in the Balkans at the time, but I mean, you're talking about thousands of people coming over the border, or being in a train station where you've got 2,000 people getting off a train, and trying to actually meet that need was placed considerable demand on people. Also, it was important to recognise that staff were sometimes overwhelmed and by the impact of what they were seeing, and were impacted by what they were seeing and what they were experiencing. If we carry on. So how we approached it was, we wanted to do something that was practical, low tech, so it could be carried out anywhere without any special equipment, and also could be run in a very flexible way. So what we came up with was 4 core blocks, each for an hour and a half, which actually doesn't sound a lot, but when you're thinking about, what are the 10 most important things I need to know about this, you can actually cover quite a lot in an hour and a half. So we had these 4 blocks, and the details are there, but they were arranged around cultural sensitivity, the impact of being a refugee or migrant on children, working together in order to benefit children and their families, and safeguarding. And we had these 4 blocks, which we then ran in either as a day or over a series of days, so that people could also come for just one block and then leave. And although all 4 blocks were interlinked, they were also standalone. So you could come and just have impact of being a refugee, and it stood alone by itself, but it also would tessellate with the other blocks as well if you were able to attend the whole, all 4 blocks. Next slide, please. And the feedback that I should mention as well, we also developed a couple of extra blocks as well on case management and on psychological first aid when we went to visit countries who said this was a particular need. So we ran the 4 blocks plus some additional blocks. So the feedback from the participants was, and I have to say that this was one thing that we were told, which was over 90% of the participants said that it would have a direct and immediate application in their work. So in terms of its usefulness and relevance, the training scored scored extremely high. And I think of all of the things that we did, that is at a personal level something that I was most pleased about, that people didn't find it a waste of their time. People also really liked the fact that it was really practical and fitted with what they were doing. So we didn't go into huge details about conventions, about legislation, about guidelines. We really tried to keep it as practical as possible, and to appreciate and to use as well experiences that people had had in the field, so real life scenarios, to help people think through what they did, what they could do differently next time. And as I mentioned earlier on, people particularly liked the opportunity to share with others, and I remember this was given in verbal feedback, but it was also given in written feedback, and there was some actually really beautiful exchanges between people. And I particularly remember one I mentioned now, since it happened in Macedonia, where actually it was someone from an NGO agency said to someone from one of the UN agencies, actually, now I really understand what you were getting at. And the UN person said, I never really appreciated why this was so important to you, but now I really see it. And I'm not necessarily saying I agree, but I understand your position. People found that very helpful, and they also found it very supportive as well. The other thing as well, which is, I mentioned people felt very supported, but people also felt very validated. I think because we were using very practical training, coming from a strength-based position, what are you already doing? What more could you do? Rather than this is what you should be doing, why haven't you been doing it perspective. People felt very validated. And sometimes people did say, I'm not sure I learned anything new, but I feel like now I'm actually, we just were doing what was instinctive, and actually I feel like now that was the right thing to do, and it's helped me to have more confidence. And the last point from feedback from participants was that people appreciated these short blocks because it meant that it didn't interrupt work or put additional burden on teams. So it wasn't like somebody had to have 3 days out of the field. It meant that people could do them, could attend as and when, and also, you know, some people, I remember one person coming to attend just 1.5 hour block on the way home from a night shift, but would never have attended a whole day of training, but could just felt that they had the energy for 1.5 hours. So if you're interested, the link is there, and you are welcome to go and download the materials, and that includes all of the materials, an explanation of how to use the materials, and then all of the resources and the session plans, etc. And I would say that it is a tool that we developed for people to use and for people to adapt. So we're not saying that this is it and this is everything you need to know, and we're not saying that this solves all problems, but actually if it's a useful starting position, then we're really happy that others feel able to use it. And now I will hand over to Alexander, who's going to talk a little bit about his experience in Macedonia working with the refugees directly.
Thank you very much, Stephanie. Thank you for very, very interesting introduction. You did mention that I can attest to the flexibility and usefulness. Certainly, Alexander, who was part of this work from the very start, who will be sharing with us his own experience from the field, and we'll talk about the situation from the field in Macedonia, will be able to do it so much better. So I give the floor to Alexander, and I will unmute myself. Alexander, please.
Thank you, Natia, for your introduction. And also I would like to say a big thank you to Stephanie for her excellent presentation, because also I see myself in the picture there. So I see myself before almost 3 years ago, where in 2015, where TDH came to the camp to see and to observe the situation, and there they did also some pictures. I was so happy to remind that time. So I will shortly give you a shortly I will talk about the refugee situation in Macedonia, and I will provide some information about the general situation now in the field, how it's going on, what is happening, how is the situation, what is the plan of the country, and my also personal experience, like training social work by TDH, and who have direct experience from the field, working every day with refugees. On the first slide, you can see the Balkan route, also, you know, from Turkey to Greece, after that to Serbia, Hungary, Austria, and Germany, and etc. And this is the route where mostly of the people were moving since 2015. So as you can see, Macedonia is a part of the Balkan route where since 2015 to now 2018 more than 1 million people passed through the country. Next slide, please. Yeah, from now the current situation is also constantly dramatic and dynamic as well, and variable every day, because mostly of the people are still transiting. People are coming in Macedonia. There are two camps, but people are coming mostly from Greece as well. Now we have pushbacks from Serbia who are coming to the camp in Tabanovce just for a short time to have a rest, and after that to continue to some of the European countries which are their final destination. After the Balkan route was closed in 2016, as you know, in March, Balkan route was closed, and in one moment in the both transit camps in Macedonia, we have more than 1,500 people in the camp, which the camp are not constructed to provide services and to provide proper accommodation for the refugees, because there could be, let's say, around 200 till 300 people to be accommodated in one camp. So the camp was overcrowded, and the people cannot have access to the shower, to the food. It was a very also dynamic situation. But however, we try to manage and to provide and to do as best as we can. Also, my organization where I'm working, La Strada, was trying to implement programs and activities which were directly focused on the refugees and migrants, especially to the vulnerable groups like minors, children, women, disabled people, elderly people who were also exposed to the risks. Please, next slide. On this slide, you can see the transit of refugees and migrants. This is the map which La Strada and also supported by TDH was giving to the refugees and migrants who were transiting through the camp. On the first time when the train was coming from the part where is written Greece, you can see there is a camp exactly on the border. From there to the another side, to the north side from Serbia, the refugees were transiting by train, and in that camp also there was don't needed any registration on some documents, so people just shortly were staying in the camp, and after that organizing to continue to Serbia. This map was one of the resources which were providing directly to the people in order to give them information how they should continue to Serbia, how far they should walk, and how they should find the way, and etc. Next slide, please. The two camps in Macedonia are operated by Center for Crisis Management, but also mostly of the activities and construction of the camp is supported by UN agency, especially donors, international donors like TTH, GSZ, DRC, CRS as well, WeAffect, and many other. So on this picture you can see on the very beginning of the camp where TDH was one of the first donors who set up like one huge tent in order to provide first psychological light and some kind of also care for the children and mothers, because in the winter condition there was very the camp is very open area, and there is a wind and temperature under maybe 10-15 degree. So TDH was one of the first donor who provides who start to set up and tents and safe space where people can have a rest and organize themselves. Next slide, please. On this slide, I will talk a little bit about my personal experience, like a social worker in the transit camp in Tabanovce. I would say that this is the very interesting experience and positive. First on my personal level, and as well like professional level, because of the perspective like social worker, this was for me like real social work. Also I have worked before on the different project, different activities focused on Roma, youth and other vulnerable groups, but this one was first situation for me to work with refugees and migrants, where the situation is dynamic every day, where on the field are required very quick situation, where we like social workers as well, psychologists, cultural mediators, translators, we need to work on identification, prevention, and providing direct protection and care to the refugees and migrants, especially to the vulnerable groups. So yeah, it was, I can say on the 2 points, like on the personal and like long life experience on the professional level. Next slide, please. So regarding the challenges on the field, like to work on the victims of trafficking in human beings and unaccompanied minors, as well other person in social risk. For me, like a social worker, it was very challenging, the language barrier, because mostly of the people do not speak English, and there were a language barrier to be able to provide direct psychosocial support, because there was cultural mediator who helped us with the translation, but when you will be able to talk on their own language, I think that will be easier, and support will be more effective. But in somehow we managed to do that using body language, using some another tools how to contact with them. Also, because it was a transit camp, we like social workers and psychologists as well, there was not time for the people to talk with them and to exchange information. So we were basically mostly focused to provide practical information in order to prevent them in some unwanted situation during their transit from Macedonia to Serbia, and after that to another European countries. So also they were traveling in the large group, and it was very challenging to do like identification very fast and to do some kind of preliminary identification. So that were like two big challenges which I face like a social worker. Regarding the positive practices and some successful stories, I would say that on the field there is need of constant adaptation of the program and the plan, because we have some plan and program which we have to follow every day, but according to the needs of the refugees and according on the daily basic situation, we need to adapt that, and we need to provide to be according to the need of the refugees. Also, socialization of the children. When I say that the Balkan route was closed, they mostly of the refugees and migrants which were present in the camp were mother and children, let's say 70% of the people inside were families. So many of the children did not attend school for a long time. Even some of them, they never attend school. So somehow we managed to influence to their socialization. Many of them also stay 6, 7, 8 months, and we were with them every day. So what it was obviously and evident how socialization is getting better. You know, in the very beginning, they just know how to play with some guns and with stones, and it was not very nice to see. But after that, we start to teach them how to write, how to read, and some non-formal education. Also, case management, which Stephanie mentioned in her presentation. We try to be like social worker or psychologist to have like a person or family to provide case management to each them individually or in groups. So in order everybody to know which is family, which needs has that family, or what are their plans, what is the family construction, and etc. Where is their final destination, what are their plans, and etc. So somehow we also managed to establish links between the professionals and migrants, because in the very first beginning we are human and there is some emotional links between us. We try to be as much empathy as we can, so to get their confidence, trust during our work, in order to meet their needs and to recognize some social risks, especially risk of smuggling and trafficking during the refugee crisis. So also me, like representative of La Strada, we try to do different activities and campaigns as well, providing direct information to refugees and migrants in order to influence into prevention of trafficking and smuggling, because as you know, the refugee crisis was very productive flow, I would say, for the traffickers and smugglers who operate. In shortly, that is my overview of current situation in Macedonia. Now, in this moment, during the April and May, we have almost more than 100 people who are transiting through the country. I will say again, they are just shortly staying in the camp, maybe for a few days, some of them for a week, for a while, and after that, many of them are trying to maybe reach the Serbia. Those who didn't succeed to reach Serbia are returned back to Greece, and after that they are trying to find their way how they will reach the European countries, because as you know, Macedonia is still not part of the Europe, and using the media, using the internet, with very few clicks they can see the situation and condition for living in Macedonia. So when we were trying to talk with them, very just few of them are interested to ask for asylum in the country. So mostly of them are trying to reach the European countries.
Thank you everyone for your presentation. It looks like Natia has had a momentary technical problem. So at this point, we'd like to open it up to questions. If you do have questions, you can type those in the question box now. Everyone is on mute, so the questions will be posed to the presenter. And thank you for writing your questions, and we will proceed with the Q&A portion of the presentation. And so we are beginning to get some questions. The first question to the presenters, both to Stephanie and Alexander, is how some of the learnings that from the field that you have over the last several years can be applied to the current situation that the U.S. is facing and to other future situations that may be similar. While it's not the exact same situation, what learnings can be applied?
To be honest, I'm not totally familiar about the situation in US now, as I see something on the news and on the articles on the internet. But what I can say about that is that, for example, from my personal experience, one of the preventive mechanisms were to stay children and mothers together when it was registration process, or when they have some issue with the police or with the institution. For example, some of the social workers, psychologists, cultural mediators take care of the kids, mother, or if the father is not present at the moment. So in the camp, because the camp is quite big, when the people were transiting, also we tried to make as much as possible awareness, to raise awareness among the family that it's important to be together and to stay together, because it was very often when when the father went somewhere to check when is the next train, or to check some another issue, when the mother is moving to another place to the camp, and when the kids are staying. So in my point of view, that in such a crisis situation, it's very it's need to raise awareness and to do much more campaigns how much important is for family for being together, because it impacts on their mental health, family distraction, and many others. So as I told you, we TTH has some I don't know how to present them. We have some cards where, in the case when it comes some family separation, we have some kind of card where where we write the name and first name of the kid, and name of the mother, and some contact telephone if it's possible, and we were putting that in the pocket of the kids in some situation, if it's come to the family separation or some issues. But it was very often also in Macedonia, when some brother or sister or mother stay in the Greece, another are in Macedonia, but there was also, as you know, Viber, WhatsApp connections, and online platforms where we were sharing information when some family is separated, and we were trying as much as fast and possible to reunion them again.
Yeah, I think just to add to what Alexander says, I mean, obviously there's quite a different quite a different context with what's going on in the border in the States at the moment. And like Alexander, I'm not an expert in what's going on, so I'm only speaking from what I've seen on the news and read, you know, in various different forums. But I think, and it seems to me there's one fundamental difference, which is, as I understand it, the policies in the UK was on separating children, whereas the focus within Southeast Europe was on trying to keep people together. But Alexander's already talked about some sort of very practical things which were done within what we might call the Balkans route. And I just would like to add one thing to that in relation to my understanding in the States is that there's been some issues about when people have been separated, even though that may have been as a result of policy, it's difficult for people to be reunified again, and people are losing track of who they are. So I think that would be one thing that I would be really focusing on, which is if you can't keep people together, then how can you help them how can you help them reunify at some point in the future? And here I must give an enormous shout out really to the Red Cross and Red Crescent Society, who were operating throughout the whole of the Balkans route, and I'm sure Alexander will agree with this, right from the beginning, and were really doing some great works, particularly with their Restoring Family Links teams across borders when people did get separated. I mean, other agencies were involved, you know, obviously UNHCR were there and trying to help reunify people, but I think because, you know, Red Cross, Red Crescent tend to be local people who know each other, who have their own links and who have their own networks and have often been to the other places. They just seem to have a way of really being able to stitch people back with their family in quite a quick and we're also able in many cases, because it was the Red Cross, Red Crescent, to be able to mediate across borders in a way that wasn't always possible for other agencies.
Great, thank you both. And we've gotten a number of questions. Unfortunately, we won't have time for all of them, but maybe one last question. There's several questions on the topic of trafficking and child protection, and how can social workers better prevent the rise of child trafficking? Are there any particular assessment tools that you have used to spot trafficking, and what types of protocols are in place when you see child protection or trafficking issues in terms of reporting to police or other steps? Alexander, would you like to start by addressing those questions?
Yeah, of course. Yeah. In the beginning, I would say that in Macedonia we have a lack of the police and another institution where we can report and where we can where we can react when we notice some issue of the child trafficking or trafficking whatever. So in the very last period, Macedonia tried to do and to establish the SOPs where there is a standard operative procedure where each case should be reported and to the police and to the institution as well. So it somehow we try to be more organized now in the last few in the last period. But in the very beginning when we start, so it was very challenging, because as I told you, people were transiting in the large group, and you can we have to be very fast, and how we will approach, how we are going to talk to them, and how we are going to raise awareness among refugees about trafficking and smuggling. So there were also a group of the kids who were transiting alone, without parents, without some adults with them. So as much as possible, we try to reach them, because we were on the field, for example, maybe more than 40 social workers and psychologists, as well another technical staff who were providing direct information in order how they should react. Also, there is online number if some of the people are directly exposed to some social risk, let's say like trafficking and smuggling. There is a number where they can, and we will provide to the refugees and migrants leaflets where they can see the number and where they can call anytime what they need. So we have many cases of the smuggling and trafficking, but I would say the lack is of institutions because they did not recognize it like trafficking and like smuggling. So it were many indicators that is the case, but it was not always properly reported and make a procedure in order to be protected the victim.
For me, and I'm aware of time, but just to say, I think what is really important is that workers take every opportunity. What I mean by this is that, you don't need to be doing a counselling session in order to provide psychosocial support. You don't need to be doing a session on resilience in order to be doing things which actually help contribute towards a child's resilience. And so what I would say is that be thinking about how can, when you're intervening with families, even if it's just showing them the way to the toilets or something, how can you actually think about doing some sort of preventative work? So even if you're directing someone to the toilets, it's an opportunity to say, hey girls, if it's two girls, make sure you stick together because and then to give a message. And I mean, I think about things like keeping children safe and safeguarding. And I will speak from my own experience. I was never, these were skills that were given to me as a child by my parents, who just told me really basic things like not to get in a car with strangers, not to go off with people I didn't know. And I'm not saying that's necessarily the preventative messages that we ought to be giving children and families in that context, but for workers to think about and to be supported to think, what is it that's actually very easy in terms of prevention and information given that can be readily given out in normal contact with people that they're coming into contact with?
Great. Thank you so much, Stephanie and Alexander, for your time and input. And thank you to Natia as well for helping to organize this webinar. And we are appreciative to all of you who have joined and participated in the webinar for the past hour plus. The webinar has been recorded and will be available shortly. And we will be posting that to our website and YouTube channel. We apologize if we did not have time to answer your question, but we invite you to continue the dialogue on our discussion boards. We also invite you to share any notices of events or opportunities, and we can share that with the network if you want to type that in the question or chat windows. And for those who are not yet a member of the Alliance, we invite you to visit our website and become a member to learn more about future webinars and other events, as well as to receive regular updates. And again, this is one of 25 webinars that are available on our website. So thank you, everyone. Again, Stephanie and Alexander and Natia for your participation and presentation, and we appreciate all of you joining today. Have a great evening, afternoon, or morning. Thank you again.
Thank you.
Thank you.